It's okay, you stay? Oh, great.
Not good?
Yes, great.
Oh, like that? Perfect. Okay.
Madam Professor, could you maybe shortly describe how was it like at the beginning when you described this?
I have to say something else, please.
Yes, okay. Tell us something.
I am happy having the opportunity to participate into this Epicana Fest with the Czech people and the Czech families of patients with epilepsy. I would like to underline that I am the founder, discoverer of Dravet syndrome. But there is not only Dravet syndrome, there are also other very severe epilepsies. So I would like to speak to Dravet syndrome families, but also to the other families, and particularly with Lennox-Gastaut syndrome, which is also a very severe syndrome. Okay, now your first question.
How was it like at the beginning when you described the syndrome? How you feel?
At this time, the childhood epilepsies were not very well known by the epileptologists, the neuropediatricians, etc. And there was in Marseille a specialized center for these children with epilepsy, more or less severe epilepsies. And there was a team. We were doctors, scientists, psychologists, educators, nurses, social assistants who worked about the direction, under the direction of Professor Gastaut, who was a very famous epileptologist at this time. We were a team. We shared all our knowledge, our observations, and we had meetings to discuss. So I was not alone in that. I would like to you understand that. Second point, we have already described other syndromes, and particularly the famous, the well-known Lennox-Gastaut syndrome. I have worked on the Lennox-Gastaut syndrome. It was the object of my medical thesis. And the first publication, I was in the authors of the first publication. So I am also concerned by the Lennox-Gastaut syndrome. And the fourth point is the genetic. The genetic was not very well developed, but we were convinced this Dravet syndrome had a genetic origin, in contrast with the Lennox-Gastaut syndrome, who did not have a genetic origin. Okay?
Great. Thank you. Thank you. That was great. The second question would be, how do you see the future? What do you think we will be ever able to completely cure the kids with Dravet? Or what do you think about it?
That is a big problem. That is a big problem because, yes, I hope it will be possible. But in my opinion, it will be possible only in a far future. Mm-hmm. We cannot hope our children now can benefit from this type of new treatment, which are acting against the consequences, direct consequences on the brain of the genetic mutation, because it is very difficult. There are many researches on that, but now there is only one trial. And one difficulty is these drugs cannot, they are not drugs, these products cannot be given easily by mouth or by injection. They have to be put in the brain itself. So that is a big difficulty. Another big difficulty is we don't know at which time we have to use that, when they will be available. At which age? Probably very young, because the consequences of this mutation are very early in the life of the child. Mm-hmm. So I am sure it will happen that, but unfortunately not for the patients we have to treat now. Mm-hmm. But in the near future, we have made already progresses. We have better drugs. And I can, and know that there are other drugs in the pipelines, how we say, in research. And to have better effect and less adverse effect.
I suppose you would agree, or you would say something what is actually also my personal question. The less seizures the kid have, the better developmental skills would be. Is it somehow connected? The seizures
true,
with
it is not completely true, because the problems of development, of cognition, of motor functioning are related to seizure, but not only to seizure. Sometimes some patients have not so many seizures, but they have also these problems because they are also the direct consequence of the change in the neurons by the mutation. So it is very important to treat the seizures, but we have to find other ways of avoid these other symptoms they have.
Yes.
Dravet syndrome is not only an epilepsy. It is a disease with epilepsy, which is the first symptom, but also cognitive and behavioral impairment, motor impairment also. You know that.
Yeah. This is what we actually have to explain many people in Czech Republic, because as it is very rare disease, nobody knows about it.
It is very rare, but not so rare. There are more other epilepsies which are more.
Yes. But this is actually our aim to show to say that Dravet syndrome is not only an epilepsy, which this is exactly what you just said.
There is another way to help these patients to have a better future. Is that the associations are acting. It is to promote the knowledge of the disease in the medical community, because there are doctors who don't know well this disease. In the educational community, because they are not always, but often refused in school, and there is not enough specialized classes, etc., for the patients, the children and adolescents who have this type of problem, not only Dravet syndrome, but also
Yes.
And also to have other treatment for them, physiotherapy, speech therapy, etc. And that is really well developed for some patients, and we see the difference between the patients who have benefited from these helps early and the others. So that is very important. And my last message should be the parents have to believe in their children, even if they have this type of problems, because they have many inabilities, disabilities, but they have also abilities. And the problem is to discover, to detect these abilities and to develop them. And you have to be confident to trust your children with the Dravet syndrome and other epilepsies, as you trust your other children, their siblings. And I think at the end, the patients themselves are not are happy, because they don't know what is epilepsy. They know they have moments when they fall
down.
But after that, they don't exactly what that does mean. And so if they are well educated and they are loved by their families and also their caregivers, not only the families. And if there is a good collaboration between families, caregivers, and doctors and other specialized for education, that is a good chance for these children. And I hope in some years, the children who become adolescents and adults will be still happy. This book has been written by myself and my colleague, Professor Guerini, this year. It has been published this year. It is the second edition of the first book we had published, but more than 10 years ago.
Madam Professor, thank you so much for your time, for your help, and for your very positive, energetic talk, because it's unbelievable. I'm very pleased to have this possibility to contact you. So thank you so much.
Thank you.
I wish you
a great pleasure for me.
Thank you so much, madam.
Bye bye.
Bye bye. Thank you.